Welcome to the future of therapy. In this course, over the past 5 weeks, we have focused on several components of distance education. The course title is Current Topics in Adult and Community Education with a focus in issues in distance education. As a result, we have had 5 different components that I will cover in my presentation outline. The first is historical and theoretical foundations. The second is organizational settings. The third is program management and support systems. 4, design and technology in delivery systems. And 5, student learning and professional development for educators. These 5 main points have been broken down into 2 separate individual points each. So, overall, this presentation will cover 10 specific focus areas to address the future of therapy. The Future of Therapy Component 1, Historical Foundations. With the future of therapy, it's actually an emerging field, and being it's an emerging field, it has risen with the internet as a total. As global communication has become more available to citizens around the country and every different nation throughout the world, this field as electronic communication has developed this industry. Um, so it is a benefit and a subsequent evolution of different technologies around the world being electronic communication. The next is the international capabilities of connecting to different groups has also allowed therapy through this means to become a global dialogue and conversation amongst different communities of educators, scientists, different theorists, and all individuals in the psychological and therapeutic atmosphere. The last is the historical foundations is because it's such an emerging field with the international connections, there's new terminology that has broken out with the trend of information, including the relevant terminology would be e-mental health or electronic mental health, telemental health for telecommunications mental health, telecom health, mental health and delivery systems. All the relevant terminology are just kind of abbreviations to the overall healthcare and mental health communication to the industry. So, although it's a new and emerging field, it is breaking down relatively new barriers and creating new types of information and terms. The future of therapy, component 2, theoretical foundations. Within this component, there are 3 primary ideas, and through these primary ideas, these connect the theoretical basis and foundations for therapy in this realm. The first is going to be e-mental health. They are looking at mental health as an electronic communication source. So the primary theoretical component to this is that we are broadening our scope of therapy from a in-person or physical realm to an electronic medium, opening it up to a much further demographic and region in the world. A part of the e-mental health, it breaks down into 2 types. There's synchronous and asynchronous. Synchronous is going to be the type of mental health communication or e-mental health that is typical in a real-time conversation that you would experience with a therapist sitting in front of you, discussing and sharing multiple dialogues about every different thing that you are interested in speaking about. This tends to be the more traditional route that people are exploring in e-mental health. It is the closest thing to actual in physical therapy because you are able to watch the cues, you are able to look at the body language of the person and understand their inflections. The second type is going to be asynchronous. Asynchronous type of e-mental health is going to be discussion boards, message boards, components, voicemails, running through a system that both allows you to respond back to them, but it's not in a real time capability or capacity. So you are going to, in an asynchronous e-mental health environment, it's going to be something that is providing support and mental health support to the client, but it's not going to be in real time. It's going to be a reply to reply. Third idea or part of this theoretical foundation is types of services proven to work. So overall, within the e-mental health, these services have been proven to work and have been studied. Electronic consultation, which is basically an assessment via online communication and documentation through the e-consultation. Then they have psychoeducation, which is training, education, and counseling through the e-mental health connection to other places through the internet. The next one is going to be progressive monitoring. So in mental health, that would be supervising a patient and watching and documenting their needs and carefully studying what is going on with their behavior. This can be done through synchronous communication and asynchronous if they're doing it through recorded documents that are not in real time. Evidence-based therapy breaks down to using different evidence, being the psychological or theoretical points within psychology itself, but not in the internet. So using different plans to have individuals stop smoking or cure depression or work on different mental health anxiety issues. You can use that evidence-based therapy in the long-term treatment, which can be done through synchronous communication as well. The last one would be internet-based depression support groups. Now, this is asynchronous. These can be message boards, these can be emails, these can be vlogs, which is a video blog of yourself and documented diary through visual communication. These different 5 aspects have been proven to work in a synchronous or asynchronous mental health capacity. Within this theoretical foundation, these have been some of the most successful contributing factors to the future of therapy.